So what happens to the vagina with menopause? I think that is an important question. We've been talking a lot more about menopause on social media, and so I love the education. It's way overdue. We shut down Women and Hormones, made physicians afraid of it, made patients afraid of it in 2002 with a big misstep in medicine with the DHEA study. But we still have a long way to go. And so if we look at the vagina and what happens, and there has been recent guideline updates with the American Urological Society and Genitourinary syndrome of menopause, or GSM. But what is that? In simplistic terms, it is if you have vaginal dryness, you get more frequent vaginal infections, vaginal irritation, have pain with sex. That's the end result of progressive urinary or vaginal changes with menopause and aging and decreased hormones. But you can have frequent urinary tract infections and get very sick from those urinary tract infections. And the vaginal tissue just isn't healthy. And so they updated the guidelines that basically talk about it being mainly diagnosed again with symptoms, with supportive exam, with a medical history, which includes some sexual history, but that doesn't really happen with medicine. We have done intakes in our active practice of treating hormone replacement with women for greater than 5 years. We do a sexual questionnaire with intake, and we have now for greater than 5 years, going on 7 years actually. But it's important to do that because no one else talks about it, and we hear that on a daily basis. So the fact that a guideline says that you should do a sexual history is probably not going to happen anytime soon. We don't even have sexual education in medical schools as of right now. So basically, it is a diagnosis that is made with history of the patient, what kind of symptoms they're having, and their medical history, and of course a sexual history, which would be important. It just doesn't happen in traditional medicine. And then it should be supported by an exam where you can find vaginal atrophy and changes down in the vaginal vulvar area. And then once that diagnosis is made, there is a strong recommendation for vaginal estrogen. And even if you're on systemic estrogen and hormone replacement, you should have some vaginal estrogen treatment. And I agree with all of that. That's a strong recommendation. And a moderate is DHEA vaginally if somebody is opposed to or can't be on vaginal estrogen. And if you're on systemic, they still recommend vaginal estrogen. So it is important that we understand that perimenopause is a transition leading up to menopause. And yes, you can have reasons for some vaginal dryness, but vaginal dryness is a complaint of menopause. And so screening somebody above the age of 35, let's get to, women that are actually transitioning and closer to that menopausal age, and the average age for menopause is 51, and of course that transition can be for 10 plus or minus years in duration of perimenopause. That's the transition leading up to menopause. But vaginal dryness happens more commonly with menopause, which is why it's called GSM, a syndrome of menopause. But they did not recommend vaginal laser treatments, and that I think is super important for us to talk about because I'm not sure why those recommendations weren't made. It said that there just was not a support of that. There wasn't study support. There wasn't efficacy that was proven. But if you look back into those same journals that have approved osmafene, which is another drug that is like estrogen-like, that is a moderate recommendation in those guidelines. Those same studies that support and were all supported by a pharmaceutical company in support of getting their drug to market for improvement of GSM, those articles were written and published in Menopause, which is a reputable journal, and in multiple other reputable journals that actually support and show lots of studies support and efficacy and safety of laser vaginal rejuvenation in the form of CO2, which is ablative, or RF, which is radio frequency, and you can use surface heating. There is some radio frequencies with some penetration or needles. That's a more severe, urinary incontinence or syndrome that you might have, or more severe symptoms, I should say. And so there is support for erbium, CO2, and RF in reputable journals, including Menopause, Climacteric, laser surgical medicine, laser surgical science, multiple studies on each of those. And I will link a list of those. And that's just the beginning list. There's much more. And going back to the year of 2014, all of them showed improvement. And there's some meta-analysis there, and no significant adverse effects. So this is something that you can do without a drug and even without hormones. I strongly support that if somebody can be on hormones, we should be in perimenopause and menopause because they are bone, brain, and heart protective. But when you can actually do local regeneration in addition to hormonal and cell health with hormone optimization, then you have enhanced improvement in symptom control. And so if you're looking at frequent urinary tract infections, urinary symptoms, vaginal infections, vaginal dryness, and worst case scenario, vaginal pain, and women are suffering with this, we should have those in guidelines, in my opinion, because there is study support for that. So we've been doing it for years. Women love it because there is improvement and symptomatic improvement, and we have not seen safety concerns, and there's no safety concerns that I can see in studies as well. So I would take a look at some of those studies and just open your mind to some non-traditional ways that we can actually treat with regeneration and giving the body back what it needs to heal. And vaginal laser rejuvenation is one of those, and it helps symptom improvement in menopausal women and perimenopausal women if they have symptoms. So seek a physician that does sexual wellness and does vaginal laser rejuvenation and is very well versed in that. And we do see a lot of remote patients. Even if it's a planning consult and you really wanted more information, then please just reach out and let us know, because we are here just to educate and open people's minds to regeneration and regenerative treatment. So thank you.